If you're being evaluated for possible mesothelioma, your doctor has probably mentioned thoracoscopy. It's a procedure that's also referred to as VATS, which stands for Video Assisted Thoracoscopic Surgery. This is the gold standard procedure for diagnosing pleural mesothelioma and for some therapeutic interventions as well. But what exactly is thoracoscopy? What happens during the procedure? What are the risks? And what can you expect during recovery? Today, I want to explain everything you need to know about thoracoscopy for mesothelioma. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding what thoracoscopy involves can help you prepare if this procedure is recommended. Let's start with what thoracoscopy actually is. Thoracoscopy is a minimally invasive surgical procedure that allows doctors to examine the inside of the chest cavity and take biopsies of the pleura, which is the lining around the lungs. That's video-assisted thoracoscopic surgery, is the modern version using video cameras and specialized instruments. During thoracoscopy, a camera the size of a pen is inserted through a small incision in the chest wall. The camera transmits video to monitors in the operating room that allow the surgeon to see inside your chest cavity in detail. Additional small incisions allow the surgeon to insert instruments to take biopsies, drain fluid, or perform other procedures. Now, before I go on, I'm going to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section and make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Getting back to thoracoscopy, the procedure itself is used for mesothelioma in several situations. The most common reason for thoracoscopy is diagnostic thoracoscopy to obtain tissue biopsies for pathologic diagnosis. When imaging shows pleural abnormalities that are suspicious for mesothelioma, thoracoscopy allows direct visualization of the pleura and the collection of adequate tissue samples for definitive diagnosis. Therapeutic thoracoscopy can also be performed at the same time to drain persistent pleural effusions that are causing breathing difficulties. Sometimes a procedure called pleurodesis is performed during thoracoscopy, and that's where a chemical or talc is instilled into the pleural space to make the pleural layers stick together, and that prevents more fluid from accumulating. Staging thoracoscopy helps determine the extent of mesothelioma spread. The surgeon can directly visualize how much of the pleura is involved, whether there are tumor nodules on the lung surface, and whether nearby lymph nodes appear affected. What happens before the procedure? You'll have preoperative testing, including blood work, chest imaging, and possibly pulmonary function tests to make sure that your lungs can tolerate the procedure. You'll meet with the surgeon to discuss the procedure, its risks, and what they expect to find. You'll meet with an anesthesiologist because thoracoscopy requires general anesthesia. You'll be instructed not to eat or drink for 8 to 12 hours before the procedure. You should definitely arrange for someone to drive you home because you cannot drive after general anesthesia. What happens during the procedure? You're brought to the operating room and positioned lying on your side with your affected side up. General anesthesia will be administered through an IV and breathing tube. Once you're asleep, the surgeon will make small incisions, typically 2 to 4, and each will be about 1/2 inch to 1 inch long, between your ribs. A camera will be inserted through one of those incisions, Carbon dioxide gas may be introduced into the chest cavity to create space and improve visualization. Surgical instruments will be inserted through the other incisions. Then, the surgeon will examine the pleura carefully, looking at the parietal pleura that lines the chest wall and the visceral pleura that covers the lung. They'll note any abnormalities that might be thickening, nodules, fluid, or tumor masses. For diagnostic thoracoscopy, multiple biopsies are taken from different areas, especially areas that appear most abnormal. Taking multiple samples from different locations increases diagnostic accuracy. Afterwards, the tissue samples will be sent to pathology. If there's significant pleural effusion, the fluid will be drained. If pleurodesis is planned, talc or another sclerosing agent will be instilled into the pleural space. Chest tube, which is a flexible plastic tube, will usually be placed through one of the incisions before closing. This will allow the drainage of air and fluid from the chest cavity after the procedure. The incisions will be closed with stitches or surgical glue. The entire procedure, it typically takes 1 to 2 hours, and then you'll be taken to the recovery room where you'll wake up from anesthesia. What happens after the procedure? You'll spend several hours in the recovery room as the anesthesia wears off. You'll have chest x-rays to make sure your lung has re-expanded properly. The chest tube will be connected to a drainage system, and you'll receive pain medication, typically both through your IV and oral pain pills. Most patients stay in the hospital overnight after the procedure, sometimes 2 nights. The chest tube will usually stay in until the drainage decreases to acceptable levels, and that usually takes 1 to 3 days. Once the chest tube's been removed and you're managing your pain well with oral medication, you can go home. Your recovery at home will involve managing your pain with prescribed medications, caring for the incision sites by keeping them clean and dry, gradually increasing your activity but avoiding heavy lifting or strenuous exercise for 2 to 4 weeks. And you need to attend follow-up appointments to have your incisions checked and discuss the pathology results. Most people feel significantly better within a week and are back to normal activities within 2 to 3 weeks, though this can vary. What are the risks and the potential complications? Like any surgical procedure, thoracoscopy carries risks. Pain at the incision sites is universal, but it's also usually manageable with medication. Prolonged air leaks occur when air continues leaking from the lung through the biopsy sites. This is the most common complication, and it requires the chest tube staying in longer, sometimes a week or more. Pneumothorax is a condition that's better known as a collapsed lung. It can occur if air leaks into the pleural space. The chest tube is meant to prevent this, but it does occasionally happen. Bleeding from the biopsy sites or from blood vessels in the chest wall is possible, but not common. Infection at the incision sites or in the chest cavity can occur. Respiratory complications like pneumonia or difficulty breathing can develop, especially in patients who already have compromised lung function. Anesthesia risks include allergic reactions, breathing difficulties, or cardiovascular problems, though these are rare with modern anesthesia. The overall complication rate for thoracoscopy is relatively low. Most procedures are completed with no significant problems. The mortality risk is also very low, typically less than 1%. Who should perform your thoracoscopy? For diagnostic thoracoscopy for suspected mesothelioma, you want a thoracic surgeon. That's a surgeon who specializes in chest surgery, and ideally, you want a thoracic surgeon at a center that's experienced with mesothelioma and the surgeon who performs thoracoscopy regularly. Experience matters because recognizing abnormal pleura, knowing where to take biopsies to get the most diagnostic information, and managing potential complications all require expertise. How is thoracoscopy different from thoracentesis? The two are commonly confused with each other. Thoracentesis is a simple needle procedure done with local anesthesia. It can be done in a clinic or even at the bedside. A needle is inserted to draw fluid from the pleural space. The procedure takes 15 to 20 minutes, requires no hospitalization, and you can go home immediately. While thoracoscopy is a surgical procedure requiring general anesthesia, operating room time, overnight hospitalization, and chest tube placement. It's much more invasive, but it provides much better visualization and tissue samples. Thoracentesis is often done first because it's simple and can provide both symptom relief and preliminary diagnostic information. But if it doesn't yield a diagnosis, which is common with mesothelioma, thoracoscopy is going to be your next step. It's also preferred when imaging shows pleural thickening or nodules rather than just fluid, when extensive disease needs to be visualized for staging, or when therapeutic procedures like pleurodesis are also planned. What questions should you ask your doctor if thoracoscopy is being recommended? Start with why. Why do you recommend thoracoscopy versus other biopsy methods? Then you can move on to other questions like, what do you expect to find? How many of these do you perform? What's your complication rate? Will you perform pleurodesis if you see significant fluid? How long will I be in the hospital? When will pathology results be available? What happens if the biopsy doesn't show mesothelioma? To review, thoracoscopy, or VATS, is a minimally invasive surgical procedure using a camera and instruments that are inserted through small chest incisions to visualize the pleura and take biopsies. It's the gold standard for diagnosing pleural mesothelioma because it provides excellent visualization and adequate tissue samples for pathological examination. The procedure requires general anesthesia, overnight hospitalization, and chest tube placement, with recovery taking 2 to 3 weeks. Risks include pain, prolonged air leak, bleeding, and infection, but serious complications are uncommon. Visit mesothelioma.net for more information about mesothelioma diagnosis, thoracoscopy, and the specialized centers that are best equipped to provide these services. Or you can call 1-800-692-8608 or use the live chat feature on the website to speak to one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.